Is it fine? Do you see my screen?
Yes, we see. Thank you.
Yeah, super. Thank you for confirmation. All right, so I'm just making a little bit of space for me. Sorry for that. So it will be more realistic, not so much theoric, because the norms are extremely theoretical, and at least I would say the bad things is behind us. Now let's speak about surfaces. So what are we going to speak about? We are going to speak about the surfaces, the different type of surfaces, the difference between visually and microbiologically clean. How do we split hospital area? What are the different frequencies? Which spectrum do we need to reach? We'll take an example of protocol in the operating theater. We'll discuss about airborne disinfection. I think it's also interesting topic. And I put the question as, is it the right complement after the surface cleaning? We'll speak about also other places like dental and cosmetic, because more and more we see that, I mean, the dental is already on the way to reach the same level as hospital, but cosmetics, more and more people are going to the cosmetics, to podologue and manicure, and we are close sometime to do some procedures. So let's hope and let's go in the way that people will use the proper proper protocol for cleaning their tools. And of course, at the end, the questions. What are the different surfaces? The first one will be the large surfaces, like we see now on the picture. So will be, for example, the corridor of this hospital. Then will be the high surfaces. So remember, in the previous one, I was talking about the large surfaces, and I was talking about the high surfaces. So high surfaces will be the flat surfaces, overbed table, the bed linen, the patient gown, sorry, the bed rail, the sink. So all these things are the high surfaces, but also we call it high touch object, because this is something that we are touching non-stop between when we come to visit a patient. This is basic. This is a basic question. This visually clean and versus microbiologically clean. What we see and what we don't see. So when we see, we think this is clean. From visual point of view, yes, it's clean, but from microbiological point of view, it is not clean. Let's go back to this corridor. We look at it and we say, yeah, actually, I went to this hospital and it's very clean. You know, most of people will look at it and say, wow, I've been there and it's extremely clean. You don't see any dirt, nothing. True, there's no dirt, but there is a lot of bacteria. There is a lot of risk. There is a risk a little bit everywhere. So in reality, it is contaminated. So it could be contaminated with bacteria, with viruses. You know, you can find a little bit everywhere the different contaminant. And what we would like to say with this, this is what we call the cross contamination. So if you see this man, if his hands are not clean, for example, or the handrail has not been correctly clean and disinfected, he will bring the contamination from the patient room to, let's say, the operating theater. So always there is a risk, and viruses also a little bit everywhere on surfaces. So it's always very important to think that there is visually clean and there is microbiologically clean. So it seems to be clean from my eyes. Yes, it's clean. But if we look at the microscope, it is not clean. The guidelines. The guidelines. I promise you I'm not going back to what we have discussed earlier about the norm. But in Europe, what we call the biocleaning. So biocleaning, sometimes people will think, okay, it's something to clean with about organic cleaning. No, this is, I think the terminology is not correct. It's basically when you use a detergent disinfectant, this is what it's called biocleaning, because bio, it's more for the life, cleaning, but so cleaning and killing. In the US, the CDC, there is a guidelines for disinfection and sterilization healthcare for healthcare facility from 2008, and they said you should use germicidal detergents, but I personally don't know what a germicidal disinfectant detergent. So this is a little bit tricky. Stay in Europe as we are in Europe. So visually cleanliness is different from the cleanliness from microbiological point of view. So the visual cleanliness and will be the macroscopic cleanliness. So we will eliminate everything what we see. So all soil on the surfaces that you can see with your eyes, you will eliminate it. The microbiological cleanliness will be everything that you cannot see. So you can see only with a microscope. So in this case, with surface swab for making the microorganism counting. What should be considered in biocleaning? So you have to keep in mind that microorganisms survive on surfaces for variable period of time. It will depend on the type of germ, on the temperature, the humidity, the surface type, the state of the surface. Sorry, is there any biofilm also? So to give you some example, HIV is extremely fragile. HBV could stay a little bit longer on surface for some days. MRSA could be more than a week. Clostridium difficile, we can speak sometimes about years. So it's really something that we need to keep in mind. How do we perform biocleaning? So biocleaning, what we say earlier, it's the cleaning and the disinfection in the same time. So we will reinforce the qualitative action of cleaning to the chemical action of the disinfectant property. So the disinfectant properties will depend on the choice of the disinfectant product, of course, and the selection of antimicrobial active ingredient. What do we target? We target the particle soil, like the dust on surfaces in the air, for example, and the biological and organic soil, like the blood, the poo, the potential, which are potential contaminant. A little bit of chemistry, just to remind you, but when we want to clean the surfaces, we are not just destroying the soil. We are, if you get soil on the surface, you come with water, almost nothing is happening. So we use surfactant in the detergent or detergent disinfectant. So the detergent has one part which is hydrophile and one part which is lipophile. So the lipophile will stick into the soil. The hydrophile will connect with the water, and thanks to the chemistry, they will be able to put in suspension the soil, and then you will be able to remove it. So when we clean, we really move soil from a surface to basically the mop, for example, to the bucket. We all know that there is four factors four factors during the cleaning, and what we do when we produce detergent disinfectant, we are doing optimization. So this is a thinner circle that all of you knows. So every time you want to clean something, it could be an instrument, it could be a surface, it could be your car, it could be your body. It's always the same. It will take time. There will be a time. There will be a so contact time. There will be a chemical action, so with chemical or soap. Will be a mechanical action with a brush, and there will be also the temperature, because the temperature always will be a good help. So when we produce detergent disinfectant, what we try to do, we try to reduce, thanks to the chemistry, we'll reduce the contact time, reduce the mechanical action, and reduce the temperature of and the temperature. So in order to make some production saving. So this is always what we try to do with the chemical. We were talking about the state of surfaces. Sometimes you look at surfaces, but it could be a surfaces one table, but it could be also endoscopes. It will be the same. You look at it and you say, oh, okay, this is clear. This is no there is no crack on surfaces, blah blah. But if you look into detail, you start to see some little cracks, and the little cracks are extremely dangerous, because if a contaminant got into the crack and you use product which is without surface tension, so it means you are not able to get inside the crack, then it means you won't be able to get rid of it. So also one part which is important, it's when we use detergent disinfectant, we always put some surfactant inside in order to be able to fulfill all cracks and avoid such a situation. So this is what we call the wetting effect. So the type of product for biocleaning, so concentrate detergent disinfectant, it's more economical to use, but also we can use some ready to use, which are more dedicated to high surfaces and also high touch objects. What do we need to consider? What do we need to think when I start to do the biocleaning, the cleaning and disinfection of surfaces in the hospital? What should I think about? I should think about the frequency of cleaning operation. How often do I do it? Once a day, twice a day, once a week, once a month, never, I don't know. So always you have to ask yourself this question. The quality of the product that you will use, definitely, it's also important. The material, the equipment you will use, and also the material you need to clean. So you have to think a little bit about how does it look like? Is there any hollow? You know, all those details are important. Also, it's important to be in compliance with the SSOP. It's very important to follow the different steps. You have to think about the architecture of the premises. Maybe there is in the room, there is air conditioning, ventilation, filters. And also you have to think about the people. How many people are coming inside? What are their behavior? Do they circulate correctly? All these things are very important. I will give you an example. On Tuesday, I was in one hospital in Luxembourg, and one, I would say the largest one, and they have one outside cleaning team, and I was with my partner, and we went to visit those people, and they were complaining, say, hey, yeah, we are using your product, but it doesn't work. It's okay. Why it doesn't work? Do you have a negative? I mean, do you have any positive swab? Yes, you see, we have positive swab. Blah blah blah. So we looked and we say, okay, how often? Then I started to ask the question: how often do you clean? We clean every day, this area, it has been decided. It's like this. Okay. Which product do you use? I'm using your product. Okay. So I'm not going to say it's bad quality. What do you have to clean? Oh, I have to clean the corridor and some rooms. Okay. So nothing complicated. Do you fulfill the protocol? Yes, I'm fulfilling the protocol. And in order to make the right dilution, we have a dosing system. Okay. I went to see the different rooms, nothing special. No, there was air conditioning, of course, but nothing extraordinary, nothing strange. Then I said, okay, show me how do you take the product with your dosing system. They show me there was one device. They opened the valve and they filled their bucket. And I look at the bucket and I said, don't you think there is a problem? And the person looked at me and said, no. I said, as a first thought, there is no foam, no little bubble. Are you sure you have product? Yeah, there is product. And they open under the dosing system. There was a canister, but the canister was not connected to the system. And obviously it was going on for a long time because it was full of water everywhere. And I look at the canister, and the canister was expired. So I think they were for a long time not cleaning. They were thinking they are following correctly the steps, but they obviously the equipment that they were having were not compliant. So it's very important. So sorry for this distraction, but I think it's sometimes some stupid details show that there is always a reason why something is not working. How do we split hospital? Hospital will be divided in different areas. So this is very important to say, okay, this area, it will. So we will define every single department, and based on it, we'll make some zones. So there will be a zone 1, which will be, let's say, with minimum risk. There will be a zone 2 with low level of risk. Again, you see this low level. There will be a zone 3 with a high risk area, and we'll make a zone 4 with very high risk level. So minimum minimum risk area will be daily cleaning. I'm not talking about disinfection, just talking about cleaning. So in this case, 1 detergent will be more than enough. And once a week, we can make a disinfection. Low risk area. So it means it will be a cleaning and disinfection every day. Okay, once a day. High risk area will be cleaning and disinfection several times a day when necessary. And the high risk area will be cleaning and disinfection several times a day, and there is no comment of when necessary. So what do we put in the different zone? So the different zone will be like zone 1 will be like the administrative area, where we see that there is not such a big risk of cross transmission. Then the area number 2 will be the low risk. So it could be some corridor, it could be some stairwell where you need a daily cleaning. The zone 3, the high risk, then here will be more maybe in pediatric, or will be in other area. When the 4 will be somewhere where you have the big risk. So you get neonatology, you can get operating theater, you can get chemotherapy rooms. So all those rooms where you get people with high risk of catching infection. So again, this is very important to classify your zone and after to put the protocol in place. Let's speak about the operating theater, for example. operating theater, we see it. Okay, what to do? What do we need to consider? Maybe the first question we should ask ourselves is, where is the most important area? There is a maximum risk, so it's always known that there is a place in the operating theater. So we said it's always 3 meters around the table where you get the big risk. So here you should do regular cleaning in order to avoid contamination. So the best would be a sterilization, but we cannot achieve sterilization with disinfectant. So we will use detergent disinfectant with larger spray. In the zone number 2, so a little bit outside the area, then we'll be with intermediate level, which will be enough. I think this is also very important to keep in mind. It's where it's blue will be the area which are not not so intensively touched, but where it's yellow, this is definitely where you have to be extremely active, very active. So, because we are touching many things, as we all know, what should be the protocol for the operating theater? The block. So between 2 surgeries, we are removing linen, trashes. We clean and disinfect all surfaces in the intermediate environment of the operating table, the famous 3 meters. And with a ready-to-use or diluted detergent disinfectant solution. At the end of the day, surface and equipment above the floor, light operating table, cleaning should be combined with disinfection with a ready-to-use solution, definitely. The floor, a wet swiping should be done, washing with a diluted detergent disinfectant, and airborne disinfection can be good to be done at the end of the day. It could be airborne disinfection, or it could be some spraying of hydroalcoholic solution. So this is something very very important. I want to make one small comment. Often we think that there is resistant. I mean, we don't think. We know that there is bacteria which are resistant to antibiotics. So at the moment, there is no clearly there is no disinfectant resistance there is no resistance to disinfectant. There is many studies which has been done, and we know that it doesn't exist. I mean, at the moment in the literature, we cannot find anything about it. Just as a reminder, the way disinfectant is acting comparing to antibiotic. Antibiotic, you go to see a doctor, you are sick, he's giving you a prescription for antibiotic that you will take for 4 days, 5 days. These antibiotics, if you look at the active ingredient, are extremely low concentration, because it shouldn't be toxic for you. It's here just to help you to get rid of the bacteria, for example. Then, if you think about the way the antibiotics is acting, the antibiotics will go on specific points. So it's like, if we want to make it simple, and it will be like taking a key, getting in the hole of the door. That's it. The disinfectant is completely different. The disinfectant is more general, because the antibiotic will go to a specific place on the bacteria to get inside and to play with the DNA. The disinfectant is not going to go to a specific place. It will just go and break the membrane of the bacteria. And what is going to happen when he is breaking the membrane of the bacteria? You will get a lease. So the whole equipment of the bacteria is going to get out. Then there is no possibility for the bacteria to develop resistance. This is it. This is just what I wanted to say. Airborne disinfection. Airborne disinfection would be, I would think, an extra safety, but an extra safety which has some constraint. The first one, the airborne disinfection, so it's done by aerosolization. It's the advantages, all surfaces will be treated. If you use a spray, you will treat only the selected surfaces, not everything. So the spectrum of activity is quite large, I would say, because it goes to from bactericidal to fungicidal, versidal, and sporicidal. The disinfection of the surface only surface, not air. This is also important to say. And most of the time we speak about terminal disinfection, but it will never replace the cleaning. It will never replace the cleaning. Doesn't matter the technique. Am I using airborne disinfection or am I doing a spraying? It will not replace the biocleaning. You will still need to do the biocleaning. But let's speak about airborne disinfection, sorry. So the airborne disinfection, so you get this device, you will spray, and the advantage, as we said, it will go everywhere. It will touch the whole surfaces, and you will have a full disinfection of the different surfaces. But it will work only if the surfaces are clean. Of course, you have to make this biocleaning before. So the way it works, it's you are installing the equipment. You start to do what we call the diffusion. Then after that, you will have to wait the contact time, and then you get the last step, which will be the recovery step. So from this moment when you install to the moment when you can go back to the room, more or less, it could be depend of the size of the room, but it could be a treatment for at least 2 hours. Here you can see the way it goes, the diffusion phase, the disinfection phase, and the last steps. Of course, the last steps shouldn't be done with opening the window, because otherwise it won't work. Sometimes we have the question for that, but it's more like you start again the ventilation system, and after 45 minutes, you can go back to the room. But you should use, if you use such type of technology, you should use technology which has been assessed, which has been tested according to the latest standard, with 17272. With it, you will be able to demonstrate antibacterial activity, mycobacterial activity, isticidal, sporicidal, fungicidal, vericidal, and sporicidal, and phagocyte, for this phagocyta, more for the food industry. As I know, there is some people in the dental area environment also. What are the different application? So the different application in the dental will be, of course, the instrument, the surface, the high surfaces again, the turbine, this handpiece place. You will get hand hygiene. You will get also the imprint, which are important. So the reprocessing of dental instruments, honestly, will be exactly the same as the instrument in the hospital. So first of all, you will do a manual cleaning. which should be done with detergent or detergent disinfectant with a neutral pH. This is very important to avoid incompatibility, corrosion. We are talking about the corrosion earlier, so you want to avoid this corrosion for the material. Ultrasonic baths also are quite popular in the dental environment. And also dental office can be equipped with washer disinfector sometime. So in this case, you need to use proper product for such a device. The sterilization has to be made after the cleaning, of course. So it could be made with steam, with dry heat sterilization, or it could be a chemical in terms of thermosensitive instrument. So in case of use of chemical, we will need to perform a high-level disinfectant, as we were talking with Gunther earlier, preferably with a peracetic acid. Because the dental has some specificity, there is one specificity. It's all those rotative instrument. So this should be a deep cleaning there. The cleaning should be done with disinfectant wipes, which is, I would say, the most effective, and because it fits to the handpiece. Also, you can make some lubrication of the inside of the part, and you have to think about sterilization autoclave. So this is some specific note also for that. But sorry, made these things. The reprocessing dental instrument, like in a CSSD, like in a sterilization unit, the moving forward is important from the dirty to the clean, with the different step, and we avoid to go in the clean area with dirty clothes. I mean, you all know this point, but it's quite important, and it makes sense. The dental, the surfaces. So the chair should be various clinical contact surfaces. So dental chair, the light handle, the countertop. So all those areas should be clean and disinfect. So ready to use wipes. I would say not whatever, but you have to use the most appropriate product to make sure that there is no incompatibility with the material. So it's always better to choose some neutral pH. But the goal is to prevent infection and to avoid cross contamination. So the best type of product would be ready to use product or some wipes. The spectrum, what do we need? So think again about what we have said at the beginning of the afternoon. The spectrum of activity could be bactericidal, yeasticidal, tuberculocidal activity is quite interesting in this case, and virucidal activity, especially for the bloodborne disinfectant, viruses, sorry. What type of composition? I would say alcohol-based is good, but with a neutral pH, because you want to avoid contamination, or non-alcohol product with quaternary ammonia-based, for example. But again, neutral pH. Avoid alkaline pH and acid pH, because again, we are always afraid of corrosion and compatibility. So what should be request from your side? So from your side, as a dental cabinet, you should ask a stomatologic cabinet, you should request. I want the proof of detergents and disinfection at the same time. So I want to see efficacy norms in dirty condition. Remember, we said that the norms are here to make sure that the end user and the producer are talking the same language, especially in a case a third party is coming to check, then everyone is on the same page and everyone is safe. So this is very, very important. And you also need to request compatibility with the material. So in my cabinet, I have this type of material. I need to use. I want to make sure that there is no risk of corrosion. Then you should ask. You should ask, for example, Danida. She will definitely be happy to help you. The cosmetic. We are talking about the cosmetic. And the cosmetic, what are the different surface application? So we get some surfaces, of course, mainly high surfaces. So in this case, ready to use product. The tools for when they cut the nails and they do the manicure. So there is a lot of small tools. So detergents and disinfectant with neutral pH, because not sure all of them are made of stainless steel. Hands, of course, you need some soap to wash your hands, and you need to make disinfection of hands with hydroalcoholic solution or alcoholic gel. The surface we will have in cosmetic environment will be where there is clinical contact, will be the chair, will be the massage bed, will be the control light, a little bit like in the dental area. So again, the goal will be to clean and disinfect and to prevent infection and avoid cross contamination. So in this case, again, ready-to-use product or wipes are the best option. The spectrum, I would suggest you to go more like the dental level with bactericidal, yeasticidal, tuberculocidal, virucidal activity, especially on blood-borne viruses. And the type of composition, it could be spirit-based, alcohol-based, but with a neutral pH, very important. Again, the compatibility. And if you make a decision to go for non-alcohol, quaternary ammonia with a neutral pH is also a good solution. But again, ask the same. Make sure that the products you are using are tested in dirty conditions, so they are really cleaning and disinfecting in the same time. And also request a compatibility list of materials. Paldis.
Yeah, it's fantastic. Thank you.
Thank you.
Yeah. Actually, we have several questions about this.
Good.
Yeah, the first one, do you know Nescafe?
Yes.
Yeah, 2-in-1, 3-in-1. Yeah.
Yes. Yeah.
Yeah, and here's the question. Yeah, I'll see this question in the chat. What do you think about products that contain disinfectants or 2-in-1 products used for everyday cleaning?
So this is what this type of products are called bio cleaning. So they are good products because you can clean and disinfect in the same time. Of course, you are not capable to reach the very big spectrum of activity, but it's a product that for daily use, which are extremely popular and used for many years in the different environment.
Okay, thank you. It was a question from one of our participants,
Okay.
but now the same from me.
Okay.
Imagine when you have two forces who are working together,
Yeah.
One is impacting proteins, another one is impacting microorganisms.
Okay.
Who is starting to work first?
Ah, okay.
Uh-huh.
Aha, I see the point. Okay, yeah. So, if I can make image about it, when we produce chemical, it's like cooking. It's a big cooking. It's a big cooking. So my colleague, they don't like when I'm using this word, but this is the reality. So we are mixing ingredient, and the knowledge of our chemist is to make sure that the product will have the capacity, when it's used in the right way, to perform the cleaning, and then to be able to, thanks to some active ingredient, to live on the surfaces and to be able to work on it. So when you use, most of the time, if you look at the composition of detergent disinfectant, most of the time they are based with quaternary ammonia. Quaternary ammonia are famous to have a long remanence effect. So,
Okay, it means that it's really safe for low-level disinfection. That we can use active agents together with
yeah,
cleaning agents.
yeah.
Yeah. Okay. So one more. Yeah. Question. When we are using aerosols for huge amount disinfection, I mean hydrogen peroxide.
Okay.
Question is ventilation necessary also when we are using just spraying? For example, sulfanios or whatever.
Okay. So when you use it on spray, if you start to spray it, you can keep the ventilation on. It's not an issue. The only moment you need to switch off the ventilation is when you do airborne disinfection.
Yeah, what is interesting, because of mostly stuff is saying spraying chemicals is better because it's only 15 minutes, but using those aerosols, it's 2 or 3 hours. Yeah. But I think it's also, if you are spraying chemicals, it's also at least 1.5 hour.
If you spray chemical, I mean, the moment the moment the chemical is working, it's when it's on the surface, then you can start the contact time. So if you start to spray chemical with a spray, it will have a time for the chemical to go down on the different surfaces and then start to work. I think the good point of the airborne disinfection is, from one point, you can spray everywhere and touch those surfaces, even the one that you are not usually cleaning, I mean disinfecting, because they are difficult to reach. And so this is, I think, what is important here.
Yeah. Okay. Thank you. And next one. Dental equipment. In one of your slides, it was shown that for dental equipment, specific equipment, you have separate, or you recommend separate cleaning machine. Why?
No. Oh, yeah, okay, I see. I know which one is it. So it's for the end piece. So the end piece, so you get the one.
Angles and straights.
Yeah. So those parts you are dismantling it, first of all. So, but there is one part which stay on the chair. So this part which stay on the chair, the best one will be a wipe. So you can use the wipe and you can do the outside. But after that, the tip would be going, for example, to be cleaned by hands, and after goes to autoclave if there is an autoclave available. If there is not, then you have to find something else. And then I was So this was just a picture. Maybe it was misleading. Sorry.
Yeah. I think it's understandable that it's not special machine, but it's a small equipment where we can connect those angles or straights and clean them. Yeah.
There is one big one. I've seen one very big one. But it was in one large university hospital, and they had one very large dental department, and they were connecting all those things to one equipment, but I think was just a prototype.
One more. Sorry.
No, that's fine.
When we speak about dentists, what do you think about spreading infections in dentists' offices? Opinion is that it's lamp handles because of touching mouth cavity and touching lamp handles without cleaning them. HIV, I mean, or
No, it's definitely. I think there was already a lot of improvement in the dental environment, but I see that the dental clinics are getting more and more better and better. Still, in some places, it's still a little bit scary. But indeed, it's true that if you usually they don't if they start to touch the lights, for example, to be next to your mouth, they should change their glove first of all, and they should go. They should make a disinfection of their hands.
Yeah, they have to. Yeah.
Yeah, they have to. Yeah.
Okay, thank you.
I mean, anytime, it's like a surgeon. The surgeon is on the body, working on the body, and doing his job. And at some point, if he get out to do something else, he will remove the gloves and he will do again the whole steps.
Yep.
I mean, it's common sense. It's common sense.
So, two more questions. So next one, disinfection and cleaning. Sometimes, it was a question that sometimes we hear, I don't know how to say this, but if I'm disinfecting, it's not necessary to clean. I think in any case, it's necessary to clean before disinfection. In any case.
Yes.
And it makes no sense. It's chemical or air cleaning. Yeah.
You always, it has been said everywhere that you can sterilize only clean instrument, for example. So if you for example, if you think about the product that you will use for pre-disinfection or pre-decontamination or the decontamination. So you get the instrument from the block, getting to the CSSD, and you will start to clean it. So the type of product that used there, whatever name or brand, doesn't matter, they are more cleaning products. They have a little bit of disinfection properties. The idea of this, most of the time it's low level plus TB, but the idea is to stop the growth, first of all, to make sure that there is no growth, to protect the people who are cleaning also, to make sure they are not getting any contamination from the tools, and also to start to prepare the last, the step of sterilization. So those products that we use are mainly cleaners with a little bit of disinfection properties.
Okay.
They will never do the job of high-level disinfectant.
Then I have no more questions. Or yeah, what's written? Okay, you can start. That's the last one. Yeah.
Okay. Okay. So the last one is will
Hands.
be about hands.